So my dream after this video is that everybody who goes into Dr. Scholz's practice or any other practice in America always thinks of the Moyad Five. Don't let your doctor tell you. Come up to Dr. Scholz and say, Dr. Scholz, I'm going to give you the Moyad Five. And he's going to say, what's that? I'm going to tell you right off the bat without you having to look it up. I'm going to tell you right off the bat what my blood cholesterol is, my blood pressure, my blood sugar, my BMI or my belly fat, or what my waist size is in terms of my pants. And then I'm going to tell you about my brain health, mentally how I'm doing. And so I'm going to cover those five more than anything else. I know my numbers, and I'm not going to accept any of those numbers that a doctor says, your number's fine, have a nice day, and you don't know the number. And I always say it's like the weather. It's 60 degrees in Michigan right now. I wanted to show you campus trees. I think it's the greatest day in the world. 60 is perfect for me. I had the windows open. It's a fall day. This is nirvana for Moyad. For people like Scholz, you come here at 60, you're wearing 8 sweaters. You probably don't like it. My point is it's relative. Just like you know your PSA, you've got to know your numbers, and you've got to know your general health numbers. So my dream is, I know your patients know everything about diet. I know all that. We have a lot of great people, but I want them to start coming in and going, I'm giving you the Moyad 5, Dr. Scholz, before we even start this conversation. My blood pressure runs 120/80. My blood cholesterol is 160. My blood sugar is 99. My pair of pants I put on in the morning is a 32. And you know what? I'm doing great. I'm in a great mood. Life is great. And I just wanted to give you those quick Moyad 5. Now can we go on with the appointment? And then there's a lot of virtual hugging or just hugging going on. I don't know why that's my speech today.
No, that's brilliant. And what's the old saying? You know, if you don't measure it, it doesn't exist.
Yeah.
So you're just kidding yourself. The only modification I'd make is which, you know, total cholesterol gives you a rough idea, but know your LDL cholesterol. Yeah.
Absolutely. Boy, now you're coming at me. Good for you. Cholesterol is relative. What I really want them to know is I want them to get the A++. I was just being generous. I want them to know their LDL. I want them to know their HDL. And I want them to know their triglycerides. Total cholesterol, as you said, is kind of a meaningless number. You can have someone that's got a really high total cholesterol, but they work out so much, their good cholesterol is 105. So in reality, they have a high cholesterol because their good cholesterol is so high. And so they should really today know their lipid profile. You know, LDL is bad cholesterol. Triglycerides is a measure of fat in the blood. And HDL, and you know, you can always tell. I call HDL truth serum. So if someone says, oh yeah, Dr. Scholz, I play tennis 7 days a week, and you see an HDL of 30, you're going, there's something not right here. This is either a genetic problem or they're not really working out this much. But you're exactly right. When you and I in the future take it to another level, they got to know those specific numbers. And it's not hard to memorize them, and it's not hard to understand that they're all impacted by what you do.
No, that's brilliant, Mark. And I'm so glad that you mentioned that, because it sounds so simple after you say it, but you and I know it's not happening. That the people are very concerned about their health. They're coming to see the doctor. They may know their PSA, but the chances of dying of prostate cancer is probably 2% of the chances of them, if they're a 65-year-old male, of dying of a heart attack. And the LDL, or the total cholesterol, indirectly will give them some clue as to whether they've got some work to do.